This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
So I'm on with Josh Butler to talk about a special bill in Texas that is kind of validating a lot of the things that he's already a pioneer on. Josh, for the people that maybe don't know you and your great company, give us an introduction and give us kind of the baseline of what House Bill 711 really is in Texas.
Oh, great. Thanks a lot, Lester. I appreciate it. Josh Butler. I'm the president of Butler Benefits and Consulting and also the president of High Plains Health Plan, a very custom self-funded health plan that we launched in 2022. House Bill 711, man, I tell you what, we were really excited when the state of Texas unanimously passed and the governor signed this bill that went into effect on September 1st in 2023. Now, I say the dates because, that was a very great day for us. It validated a lot of the work that we do with High Plains Health Plan that we've been doing since 22. This bill went into effect in 23. But here in Texas, we call this the Tier and Steer Bill. And basically what this piece of legislation allows plan sponsors or self-funded employers to do, or even fully insured, but we'll get back to fully insured here in a minute. I think we need to stick to self-funding, is it allows self-funded plan sponsors to basically customize their plans where they can tier their benefit structures, much like High Plains Health Plan does. We have a tier 1 and a tier 2 network, and they can steer their members to high quality, lower cost providers. And the steerage component is a financial incentive, things like $0 deductibles and $0 copays, which is precisely what we do with High Plains Health Plan. So in High Plains, we have a narrow network, which we call Tier 1. And then we have a very, very broad national PPO network that is a wrap network that we call Tier 2. And when our members seek services or seek care within our narrow network, Tier 1, they are financially rewarded with a $0 copay and a $0 deductible, and in many instances, $0 out of pocket. But they can still receive services in the broader PPO network, but they might have a $3,000 deductible or a $35 copay or some co-insurance and out of pocket. So that is the whole premise behind tiering your benefits and steering members to high quality, low cost providers. And Texas, to my knowledge, is the first state that's kind of codified this into our legislature, into our regulatory environments for health plans. And it's a pretty big deal.
I've got 3 questions. Number 1, do you think, or why wouldn't they, if the answer is no, if we're seeing that the outcome of this is actually lowering healthcare costs, then why wouldn't every major insurance company want to be doing the same thing? So are they doing it? And if not, why not?
So I'm going to use one example, and I'm going to answer the last questions first. Are there any of the major insurance companies doing it? And the answer is yes. Just this year, United Healthcare launched a product called Surest, and they have a mobile app where a member, they have variable copays, and it is predicated on cost and quality within United Healthcare's data. So now a member can pull up, put in their zip code, and say you're searching for orthopedic surgeons, Lester, and you need to go get a consult because you might need a surgery. They're a specialist. Well, one specialist copay may be $20, and another orthopedic surgeon who may have lower quality scores within the UHC data, or maybe their prices are higher or something like that. United Healthcare's Surest product may assign them a $100 copay. And so they are already starting to tier and use a variable copay within that plan design and within that specific product called Surest with United Healthcare. So absolutely, we're already seeing major carriers adopt this capability to steer people to higher quality. Now, why aren't all of them doing it? Why? Well, here's a more fundamental question. Why aren't the big insurance companies just negotiating better rates for the payers? And I think that you've covered this, for a lot of years. We've all talked about the medical loss ratio provision of the Affordable Care Act and the lack of incentive that major networks and major insurance companies have to lower our healthcare costs. On their fully insured side, it definitely doesn't make sense with and jive with the MLR provision, the medical loss ratio provision of the ACA. So that's one big reason. If healthcare costs are lower, Lester, that means they got to lower their premiums, and I don't think there's any carriers out there that are wanting to do that.
Yeah, yeah. When premium equals revenue, we know what the answer is. I want to go back to, and I appreciate you giving the credit to the surest products there. But when we look at it, let's just say in your market, the direct contracts that you have been able to negotiate and the fact that you are completely waiving the deductible and the out of pocket, net, if the member still made a better healthcare decision than they did before, net, at the end of the day, a direct contract that is giving a way better benefit, because free is still better than 25. 25 is better than 100, but at the end of the day, the outcome is best. Is it true that the direct means that you've been able to negotiate with High Plains is still generating a better number?
Absolutely. And this is why, we're such big fans of the transparency and coverage rules, and the hospitals that are compliant with those rules, that are posting their machine readable files, where we're out there and we're using tools like NASHP and, so RAND 2.0 and RAND studies and all of those types of analytic tools that are available to us out there, where we're really assessing and we're really digging in and starting to compare, what does Blue Cross Blue Shield pay this hospital versus Cigna versus Aetna versus United versus High Plains. And we know where we need to have a competitive contract. But one thing that was surprising to me, Lester, I was very surprised when we first started, embarking on this journey, is I had a lot of doubt and skepticism that the clinical community would be willing to take less money for their services. But it turns out it's all about they are willing to take less money under certain circumstances. And one of those circumstances was when we leverage tiering and steering. When they know that we are not monetizing our contracts, I don't charge a network access fee, I don't charge a percentage of savings, and I don't charge a percentage of build. And I've been on this topic pretty hot and heavy the last few weeks. That means something, because some other entities who shall remain nameless, they're out there negotiating direct contracts too, and they're getting a great deal. But then if they turn around and charge 25% of savings, that's 25% of the savings that just got eaten up in the form of a fee. We don't do that. And so doctors can feel really, and facilities and entities and clinical organizations, they like our model, because here's what we tell them. Every dollar of discount you're willing to give High Plains Health Plan, we turn right around and we give it to your patients. We give it to your patients and your future patients that will steer to you because of the $0 deductibles and copays. Now, not every clinician is influenced by more volume, especially like in primary care settings. They don't need more volume. They are overwhelmed as it is. But in the acute care setting, and especially with hospitals, where you might have a market with multiple hospitals that are competing for acute care business, they do want volume. And so that's one of the levers that we pull to help negotiate great contracts.
So if we know that this is possible, and it's not that if it's possible, you have proof, you have data, I've seen you willing to share it all and everything. What's your piece of advice you give to every employer that's out there as we start going into the 2025 season?
So employers, my advice is always this. In Texas, we have multiple other bills like HB 2015, for example, that's been around for 25 years, where even when you're fully insured and you only have a few employees on your health plan, you can get certain claims data from your insurance carriers. So we always start with a risk assessment. And so I know that if a company has 100 employees and they're fully insured, and they're collectively, between their payroll deducted premiums that the employees are paying and the company's contribution, let's say they're paying $2 million in annualized premium. I don't care if they want to talk about self-funding or not. I know that their risk tolerance is at a minimum $2 million. That's what they're spending in fully insured premiums. And that's 100% risk, right? You're going to pay you're not getting any of it back. So I know that you have a risk tolerance of at least a threshold of $2 million. So then what we do is we get in there, and if we can start with being competitive on price, because that's where almost every employer conversation starts, is on price. Can you save me money? Well, once we cross that barrier, then we start to show them how we save them money and say, look, doesn't it make more sense to pay $20,000 for a surgery versus $60,000? And maybe your loss ratios, I had a client or a company, a prospect tell me recently, there's no way you can help us. Our claims are more than our premiums. And I'm like, yeah, but you're with a Buca carrier and you're paying 240% of Medicare. What if you were paying 160% of Medicare? I bet your loss ratio wouldn't be 114% then. And so I think it's just educating. Employers need to be versed on what is driving your costs. And the cost of insurance is high because the cost of your care is high. So, I mean, that's just common sense.
Love it. Love it. Healthcare does not equal health insurance. And that's what this is. Josh, if somebody listens to this and wants to get a hold of you to talk about the tiering and steering, where might somebody be able to find you?
I'm prevalent on LinkedIn. I know you'll probably post this on that platform. High Plains Health Plan is our website for our plan. You can see how we built it. You mentioned that we're pretty transparent. We are very transparent. I believe in moving our industry forward through the sharing of information and knowledge and experience, because that's how I've learned, Bless. I've learned from people like you and people like Dutch Rojas and people like Dave Chase. And I learned from a lot of different people. And I think that we all have some level of responsibility that if we want to see systemic change and real change, you mentioned this before we started recording, one person is not going to make a dent in anything. And so I'm just trying to make a dent right here in my corner of the world in the Texas Panhandle. Our website's hphealthplan.com. I'm on LinkedIn. You can search me on LinkedIn. I'm happy to share information. We are mentoring some other consultants and brokerage firms around the country who are developing in their own plans that are going to be very, very similar to High Plains Health Plan. And so, yeah, I'm an open book. Like you said, I'm always willing to help people.
Awesome, Josh. Thanks so much for sharing your wisdom and being a leader for change.
Thank you, Lester. Appreciate it.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.